I had a request to do a video on malingering and disability, so that's the topic of this video. There seems to be a deliberate attempt in the medical literature to avoid the topic of malingering, and I'm not sure why that is, although I have several theories. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, my definition of malingering is deliberate, conscious attempts to deceive a doctor in order to obtain something of value to which the patient is not entitled. And commonly these things of value include money, drugs, reduction in criminal charges or sentence, hospital admission. Yes, there are some people who just love being in the hospital and will lie and cheat in order to get admitted, and also insurance payment. Now, there's a lot of confusion about what is and what isn't malingering, and the first point I want to make is that the majority of functional patients I see for Social Security disability exams, people who tell me that they have a medical condition who actually do not, are not malingering. They're not deliberately pretending or attempting to deceive me. The majority of them have hypochondriasis. These are people who are obsessed with problems with their body and actually believe that they are seriously ill or injured when in fact they are not. These people are very high in trait neuroticism, the sensitivity to negative emotion, sadness and worry, also called anxiety and depression. I find that most of these people have what I call the neurotic face. They often look like they've never had a good day in their life. Another type of functional patient that is not malingering is the patient with a somatic delusion. These people are more on the psychotic spectrum. They have a fixed belief about their body or their health that's wrong. An example would be a person I saw some time ago who'd had an accident and injured one of their arms. They'd had surgery and the arm had healed up quite well, but they were absolutely convinced that they could not use that arm at all. They acted as if that arm was completely paralyzed, like from a stroke. Another type of functional patient that I think is actually normal is what I call symptom exaggeration. These are people who actually have an illness or injury, are applying for disability, and exaggerate their symptoms. And in many cases, I think this is completely understandable. Often these people are in a very bad way with no health insurance, no income. Some of them are facing losing their home or their savings or their marriage, and some of them are really pretty desperate. And I think if I was in similar circumstances and I had, say, a limp, I might exaggerate that limp just a little during my Social Security exam in hopes that that would get me approved. I think a certain amount of exaggeration is normal and acceptable, and I don't remark on it unless it's extreme. The person is really exaggerating what's wrong with them. The second point I want to make, and I've seen physicians make this error, is that a person is not functional or malingering just because you can't find evidence of the disease they're claiming to have. There are many conditions that sometimes present without any physical evidence. Myocardial infarction is one. I've seen appendicitis present with no physical signs whatsoever. And there are some times when a person will present with very atypical physical signs. For example, I've seen appendicitis present with left lower quadrant pain and with right upper quadrant pain. I've never seen it present with left upper quadrant pain, but I bet if I spent another 50 years in medicine, I'd see such a case. Every time I consider functional illness, I require at least 3 indications that the person is functional. I will not make the diagnosis based on just 1 or 2 unless the 1 or 2 are really pathognomonic, and that's quite rare. Now, I want to talk a little bit about the type of person who malingers. The type of person who pretends to have a medical condition they know that they do not have. These patients are in the criminal spectrum. They tend to be on the psychopathic spectrum. They are perfectly fine with lying and cheating in order to get things that they know that they're not entitled to. Now, an important characteristic of psychopaths is that they're unusually low in neuroticism. They have extremely low tendency towards anxiety or depression, less than a normal person. So if I see someone who seems quite depressed and or anxious, that's very unlikely to be a malingerer. If they're a functional patient, they're much more likely to be suffering from hypochondriasis. The second characteristic of people on the psychopathic spectrum is that they're narcissistic. They have an overinflated impression of themselves. They're overconfident. They see everyone else as chumps, suckers, and they're the superior person who can fool the chumps and the suckers. This is often their downfall when they're malingering a medical condition, because not only are they narcissistic, they're also low in trait conscientiousness. Trait conscientiousness includes industriousness and orderliness. These people don't take the time to really research the medical condition that they will pretend to have. They think that they're so smart and superior that it will be a piece of cake to fool the doctor, who's a chump. And because of this, they'll often display symptoms and signs that doctors know are not associated with the condition that they claim to have. The third point is that there's a lot of nonsense written about psychopathic folks in the medical and the lay literature. And one of the most nonsensical claims is that they have no empathy. And the exact opposite is true. People on the psychopathic spectrum are extremely high in empathy. They have to be. They're very good at reading other people's emotions. They can tune in to what the other person is feeling with almost unerring accuracy. And there's no way to be a good con man or con woman unless you're capable of doing so. What they're low in is sympathy, a resonance with the emotions with the person they're dealing with. If the other person becomes sad or upset or depressed as a result of their actions, it has no effect on them. Some of them are sadistic and may actually be pleased when they induce negative emotion in their victim. The people who actually lack empathy are people suffering from autism. When you deal with an autistic person, it's clear that they have no clue how their speech or behavior affects others emotionally. And that's one of the main problems autistics have. They can't navigate the emotional world of others. In line with the sadism of psychopathic people, there's a thing called duping delight. The psychopathic person delights in fooling others. It reinforces their narcissism and sense of superiority. And they may lie just for the sheer pleasure of getting over on the other person, when there's nothing actually to be gained, such as money or drugs, from lying. An associated example of the sadism is that the psychopath may subtly insult the examining doctor with things that you can't exactly put your finger on as an insult, but make you feel bad. An example that I've heard is a psychopath is being examined by a doctor who's a generalist, and the psychopath asks what their specialty is, and when the doctor says they're a generalist, the psychopath will say something like, "Oh, so you're not a specialist." So how do you identify the malingerer and differentiate them from the other types of functional patients? Well, as I've already mentioned, these people will be extremely low in negative emotion, extremely low in trait neuroticism, much lower than the hypochondriac, and lower even than the psychologically normal person. The second feature is that their narcissism may be reflected in the way they're dressed up. The typical psychopath would like to be a sharp-dressed man, and they may have quite flamboyant dress. For example, I had one malingerer come in dressed all in bright red except for his gold lame shoes. For women, the seductively dressed woman should be a red flag. Seductive dress is not what normal women wear for an appointment with a doctor. These people will flamboyantly display braces, bandages, and splints. They will wear them, if they wear them, on the outside of their clothes, so people can't miss them. In contrast with the actually disabled person who's unhappy with being disabled and tends to conceal signs of disability, putting their splints, bandages, or dressings under their clothes, if at all possible. Another feature will be impossibilities in the medical history. The person has not really researched the condition they claim to have and is giving often hyperbolic and ridiculous claims in the medical history, such as a patient I had who claimed to have terrible back pain that radiated to their eyeballs, which is physically and anatomically impossible. There may be impossible signs on the physical exam. For example, I had one patient who could stand and walk normally. However, when I did formal strength testing of the legs and asked the patient to push and pull his lower legs and feet against my hands, they barely twitched their leg muscles, demonstrating leg weakness so severe that if it was real, it would have been impossible for them to stand and walk. Now, One of the things that I've learned really the hard way is that when I see or hear these impossible complaints or signs on the physical exam, it's best not to confront the patient. Don't express disbelief or incredulity. It never gets you anywhere, and it may cause the patient to erupt in anger, because these folks often believe that they can intimidate or bully the doctor into getting what they want. I just keep my mouth shut and record what I heard and saw in the medical record. The next thing I think is that it's important to get over the inhibition many physicians have in using the diagnosis of malingering. We all know that there are some people, a small percentage, I would estimate that it's 1 to 3% of the disability patients I see, who are malingering. And it's important to keep these people out of the disability system. As you all know, Social Security is in financial trouble, and there's a lot of worry that benefits may have to be decreased in the near future. So the last thing we want is for Social Security to be paying out money to fraudsters. On the flip side, it's very important not to label a person malingering unless you're absolutely sure. On occasion, I've had a patient that I simply could not figure out if they were genuine or pretending, no matter how carefully I examined them or questioned them. And in that situation, I put down in my report that I'm simply unsure, and I recommend an evaluation by a specialist in whatever field the person's condition lies. The next thing is to just say no to drugs when you get a drug-seeking malingerer. If you don't, you will be overwhelmed with drug-seeking malingerers, because these people communicate with each other, and they call a physician who's easy to fool a script-writing fool. Don't be the script-writing fool in your neighborhood. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.